This issue is about protecting women's health, but it's also a class issue. Women living in areas of disadvantage are going to have 3 times more chance of getting cervical cancer than the average. These are the people who are going to lose out, the young women who are going to lose out because of the decision. People who can afford to pay are going to be able to access vaccination. Those who can't are going to suffer. And that is unacceptable, Minister, and I don't think even you feel that that is acceptable. And that's why it's so disappointing that you haven't ensured that this would be a priority for you. When you look at the government record in relation to early diagnosis and early detection, it's abysmal. Breast cancer, breast check still hasn't been fully rolled out. We have still an extraordinarily limited rollout in terms of cervical cancer. That particular programme goes back to the Rainbow government and the cancer strategy. And yet we're not seeing, until now, a commitment in relation to rollout of the screening programme. But here we have a protective measure, a vaccination programme that will prevent, rather than early detect, will actually prevent. And we have some record in Ireland in tough times of vaccination programmes for children. If you go back as far as Dr. Kathleen Lynn in St Ultan's Hospital in the 30s and the 40s, when there was no money in this country and children were vaccinated, and the BCG programme when children were vaccinated. And now we are saying, in this year, 2008, that young women cannot be vaccinated because the government have too many ministers of state, 21 ministers of state, costing, not even taking into account their salaries, but the running costs to back up those ministers of state is $500,000 a year. And we can't find 10 million to protect young women from getting cervical cancer. That is not acceptable, Minister. And we would urge you now to go back and reconsider the announcement you've made. And I don't think anybody would blame you if you come out and say, I'm sorry, I got it wrong. I think people would applaud you for it, because we all appreciate the difficult economic times we're living in. But to actually attack young women and children who have this opportunity now, and many of them have been promised this opportunity and need this opportunity, to deny them now. You know, we talk about death by 1,000 cuts. This is death by one cutback that will affect the lives of women whose lives could be saved if you make the right decision and reverse this appalling decision that you've made.
Good, Margaret.